You know, as a doctor, I hear one phrase more than almost any other. It usually comes right before we have to talk about something serious. And that phrase is, I just thought it was nothing. So today, let's talk about why those nothing symptoms, those tiny little signs, actually matter a whole lot. Not just for you, but for all of us.
Come on, we've all done this, right? You wake up, you've got that tiny tickle in your throat, or you're just feeling a bit off. You've got a million things to do, so you tell yourself, it's just a little cough, it's nothing. But here's the question we really need to ask ourselves. Is it really nothing?
And that's our default setting, isn't it? Just dismiss it. I mean, we've got work to do, errands to run, people who are counting on us. We're practically trained to just power through it. But that habit, that instinct to ignore the small stuff, well, it might be hiding a much bigger risk.
And we're talking about the classics here. You know the ones. That slight cough. Oh, it's just my allergies acting up. That mild fever? I'm just a little run down. A stomach ache? Must have been something I ate. See, we have an excuse for everything. A little story that lets us just get on with our day.
Okay, but this is where we have to zoom out a little. We need to connect how we feel personally with the much, much bigger picture. Because what feels like just a small annoyance to you, well, it can actually turn into a huge problem for everyone else.
Here's the thing you have to understand. A lot of infectious diseases, they don't announce themselves with a marching band. They sneak in. They start really, really quietly. You might feel, 90% fine. But that quiet beginning, that's often when you're the most contagious, spreading it around without even knowing.
And this creates a huge and, honestly, a pretty dangerous disconnect. Look at this. On one side, you have how we feel. I just have a mild fever. But on the other side, you have what we do. I'm going to work. I have a little cough, so I'm still going to go shake hands. My stomach's a bit upset, but I'll still share my pen or my phone. That gap right there, that's ground zero for an outbreak.
And really, it's that simple. This is it. This is how outbreaks get their start. They don't just magically appear. Nope. They're built one tiny interaction at a time, from all those moments when someone who feels just a little bit sick decides to carry on like everything's normal.
Now, let me be really clear about something. This is not about pointing fingers. It's not about carelessness. Nobody wakes up and wants to get other people sick. It's a habit, pure and simple. It's been drilled into us. Be tough, power through, don't let a sniffle get in your way. But for the sake of everyone around us, we really have to start questioning that habit.
So what do we do about it? Where is the solution?
Well, it all starts with a change in perspective, a mental shift. We need to stop thinking of that little cough as our personal problem to deal with and start seeing it as our public responsibility to manage.
Let's give this idea a name. Let's call it early action. And it's all about changing the question we ask ourselves. We usually ask, am I sick enough to stay home, right? But we need to flip that. The new question is, could I be contagious enough to make someone else sick? It's about choosing to be responsible instead of just trying to be tough.
And here's the first big part of that new mindset. Seeking medical advice early, that doesn't make you weak. It means you're being responsible. Let's get rid of this whole idea that going to the doctor for something small is being dramatic. It's not. It's being a responsible member of your community.
Next up is a big one, especially in our hustle culture. Staying home when you feel unwell, that's not lazy. It's an act of protection. You're not slacking off. You are actively building a shield between a potential illness and the people you work with, your friends, even strangers at the grocery store. It's one of the most protective things you can do.
And finally, this is so important. Paying attention to your body, that's not being a hypochondriac, and it's not living in fear. It's just awareness. It's being smart. It's like looking at the dashboard in your car. You check the gauges to prevent a breakdown. This is exactly the same thing, but for your health and everyone else's.
All right, so we've talked about the why, that big shift in thinking. Now let's get down to the how. What are the actual simple things you can do that make a huge difference?
You know, when we picture disease control, we think of fancy labs, big hospitals, government agencies. And yeah, they're all super important, but they're not the first line of defense. The real starting point for stopping an outbreak, it's not in some sterile, high-tech building. It's you. Seriously, it's you, in your own body. You are the first one to know when something feels off. That makes you the single most important early warning system we have. Your choice to act on that feeling, that can literally stop a disease in its tracks before it even has a chance to get started. So, what does acting on it look like? It's just 4 simple things. Number 1, rest. It lets your body heal and it keeps you away from others. Number 2, avoid close contact. That's a no-brainer, right? It's the most direct way to stop the spread. 3, keep up your hygiene. Wash your hands, you know the drill. And 4, if things aren't getting better, go get proper medical care. That's it. Simple stuff, but unbelievably powerful.
So let's bring this all home. I want to talk about the incredible cascading impact of one person's choice. I like to call it the power of one. It's easy to think, what difference does it make if I just stay home one day? It feels so small, but think about the ripple effect. That one decision could stop you from passing something to, say, 2 other people, and then they don't pass it to 2 more people each, and on it goes. Your tiny action sends out these huge waves of protection, especially for the people who are most vulnerable.
And really, that's the key takeaway here. Public health isn't just about some huge, dramatic, global emergency. It's not something that just happens to us. Real public health is built, brick by brick, from the millions of tiny, thoughtful decisions that ordinary people make every single day.
So the next time you feel that little tickle or that wave of just feeling off, I want you to remember this. Your body is talking to you. It's giving you a chance to make a choice that holds the power to protect your family, your coworkers, your entire community. So, the only question left is, are you going to listen?